Yeah, hi, welcome everyone. Welcome to today's Centre for Care and Circle seminar. For those who don't know, I'm Nathan Hughes. So I'm professor at the University of Sheffield and involved in the leadership of both those, both the research centres that kind of co-host this seminar. And as you might have already gathered from the conversation between Jerry and I, I'm really pleased to be chairing this session, not least because it gives me a chance to reconnect with Jerry. So Jerry is Professor of Mental Health and Social Work, at least until April at the University of Birmingham, and he's spent his career really kind of bridging, I guess, the divide between frontline social work and research in relation to kind of mental health and adult social care. As I say, we go way back, and we spent quite a bit of time. I guess it's a decade or more ago, talking about kind of
Nearer two, I'm
family-minded
afraid.
approaches and yeah, how they might sort of work in practice, including in mental health support. So it's great to see this thread kind of playing through in this
Mm.
project today. And he's joined today by Philip Kinghorn, also from the University of Birmingham. And Phil's senior lecturer in health economics. And he's one of those very rare but very valuable things, a health economist who's interested in social care. So everybody note down his name for future collaborations. And his work focuses on how we measure and value outcomes for economic evaluation, and then particularly around kind of well-being and health and social care, I think. So Jerry and Phil have spent the last 3 years leading an NIHR-funded study on family group conferencing in adult social care and mental health services. So yeah, today they're gonna walk us through that study and some of their findings. Yeah, Jerry and Phil, I realise I don't know how long you've been told to talk, but I'm guessing it's like 40 minutes max. So might
Mhm.
start to bother you if we get to approach that time.
Mm.
And then everyone else, the usual drill. If you want to ask questions at the end, please raise your hand. Or if you prefer, you can sort of write them into the chat function, and I'll happily read them out for you. But I'll hand over to Jerry and to Philip.
Okay, well, thanks so much for that introduction, Nathan. And it is nice to reconnect. So it actually goes back to about 2007 when the Cabinet Office was pioneering its work around Think Family. And some of these threads have gone nowhere, and some of these threads have carried on a slow burn. And it's quite interesting the time that some of these things do take to come through. So in the last few years, there has been quite a growing policy interest in family, and I will explain later, family and group conferencing for adults. And so this research is feeling like it's quite timely, and landing within a policy and practice environment is quite receptive to more family inclusive ways of working. So this is what we're going to be talking about. So the research, as Nathan said, has been going on for 3 years. We had a team of really anybody that was anybody within the field of family group conferencing that was interested in doing this with adults. And we had a very strong element of lived experience researchers, practitioner researchers, and we've partnered with an organisation called Community Catalysts, who are doing a brilliant job now in terms of taking this forward with government, with local authorities, with voluntary sector, and so on. Very broadly, this is what we did, and this is what we've produced. So we did an initial scoping of the field because it was a bit like the Wild West. Nobody had really looked at what family group and conferencing was doing in the adult space, and there was no particular regulation of it or anything. So finding out what was going on and how people thought that it was working, what were the components, and coming up with a characterization of the model and an outline program theory of how we thought it worked. The second element was tracking the experience of samples of central persons and network members.
No quiere votar.
And,
No sabes. Está de camino, quiere comer.
and that was what we're going to be focusing on today in terms of the presentation mainly. And the outputs of that are around outcomes and case studies and costs and consequences. And the third thing was a Delphi consultation to firm up with the sector how actually we should be defining family and group conferencing in a practice context. And out of this, we've produced standards and guidance, which are now available via research in practice. So for those of you that aren't familiar with what a family and group conference is, this is a graphic which gives you some idea that it's really important. The before bit is really important, and a lot of skill goes into that because quite often people are shy, embarrassed, angry, alienated, and the thought of actually getting in a room together with the people that matter to them and potentially a bunch of professionals is not something that is necessarily something that they are going to feel comfortable doing. So it's relationship building, it's trust building, it's connection. Then there is the actual conference itself, which typically comprises three elements. An introductory part where invited professionals and others are part of the discussion, but it's a different sort of discussion. It generally starts with sharing of food, getting to know each other as people, and then talking about the things that matter to each in a safe environment. The second bit, which is probably the most radical bit, is the concept of private time, when everybody else just leaves and it is the person and the members of their network that have the opportunity to talk about what they want, how it's going to work, who needs to do what, and so on. The coordinator hovers in the background so he can be there to assist if needed, but it's really important that this is private time. And then at the end, the coordinator is invited back in, and the outline of the plan that the person and their network have drawn up gets written down, clarified, checked out if it involves input from services and so on. And then there is a plan that everybody is signed up to. And after, and this is really important, is that there is some follow-up, there are reviews, and there is a mechanism for checking that what seemed like a great idea at the time is actually working in practice. And it needs to change. Circumstances change, plans may need to change. So this is a flexible model. It's not setting something in stone. Quick note on language. What we did quite early on was insert this word and. And this is important because in practice, quite often the people that matter to a vulnerable adult are not necessarily their family of origin or any other obvious conception of family. They are the people that matter. They may be friends, they may be the local faith leader, they may be neighbours, they may be whoever, or combinations of all. And it was problematic that people were saying, well, why don't you have a family group conference? And they were saying, well, I haven't got a family, so can we go on to the next one, please? So this is probably our greatest single innovation in the field, is introducing the word and the significance that goes with that. Just in terms of language, we're using the term central person to describe the person around whom the family and group conference is convened, and everybody else we are calling network members, and they may be, as I said, all sorts of significant others in that person's life. So initially, we looked at program theory. What are the contextual factors that make a difference in terms of how effective an FGC might be? What are the processes and mechanisms of change? And what are the range of outcomes that may be achieved? Skimming over this rather quickly, but things that really stand out as important. FGCs only work if the wider professional system is willing to let them work. And they are radical. They are about saying to professionals, maybe you aren't the best people to be making the decisions about people's lives. Maybe it is those people and the people that matter to them that are going to make those decisions. So in a very real and practical sense, the professional system has got to be willing to take the risk and able to devolve power to people and their networks. Something that stood out very strongly throughout the research is the wonderful people that have taken on the role of family and group conference coordinators. And it is crucial that they are independent and seen as being independent, and that they are seen as being, above all, human. And in the current professional and service climate, lots of people told us that the FGC coordinator was like a breath of fresh air, somebody who actually listened, somebody who was able to see the world through their eyes and give them support in creating the space for their conference. Structure and practicalities matter a lot. A neutral venue, some nice food, possibly some ground rules. This is about people that normally transact in certain ways, getting out of that particular way of being top dog, bottom dog, carer, receiver of care, professional, whoever, but actually encountering each other much more as people who all care and people who may find new ways of relating with each other. And finally, a real focus on creativity and adaptability. No FGC is the same, and some ones have taken place in very unusual places, in very unusual circumstances, and they have worked brilliantly. It's so important that whatever way it's structured fits with people's cultural and social backgrounds. These are some of the key processes and mechanisms that make it work when it works. Firstly, inclusion and connection, widening the circle of people that are involved. And this is just as important for informal carers as for central persons. We often encounter situations where it is one person very much feeling on their own who is providing nearly all the informal care to somebody who is vulnerable or needs care. Power and shifting power, and people, both the central person and network members, having that aha moment of, yes, we are in charge here. This wasn't just a sham or a joke or whatever. We really do have a space where we can create our own plans for what's going to work for us. Preparation, as I said before, is very important. And to use a term used by a person who'd used an FGC service, the concept of scaffolding, having that structure around to have potentially quite difficult conversations in a way that is safe and constructive. It matters who comes and who gets it in terms of the process. We've come across a number of instances where, for various reasons, key people weren't invited, and that affected the outcome that was possible. We also had scenarios where people were invited but just didn't get it. One scenario I can think of where two social workers were involved. One absolutely got it, the other just didn't. And from the perspective of the central person and network, it was very obvious who were the professionals they could work with and who they couldn't. And finally, there is the possibility of restorative processes. People who provide FGC services are very clear that FGC is not family therapy, but FGCs can produce sometimes quite major outcomes in terms of changing the relational field around a person. They can provide a space for acknowledging feelings and vulnerabilities. They can provide a space for acknowledging past harm and difficulties and moving on. And it is really quite surprising and almost humbling that sometimes something really quite major can take place within the context of one meeting, obviously with a lot of preparation beforehand, and something that lasts and sticks. So, on the tin, the FGC is supposed to come up with a viable plan that reflects the interests and preferences of the central person and their network. Plans tend to focus primarily on the practical, but actually can have implications well beyond the practical. But it's already seen from what I've said, there is other things that are happening through the process and through the plan, which are bigger and more fundamental changes in how people feel about themselves, how people feel in relation to each other, and crucially, what they're able to do. We'll talk about these in more depth with examples from our interviews, which will flesh this out. But broadly speaking, a lot of people found that really for the first time in their engagement with services, or sometimes in terms of their experience of their wider network, they felt they were recognised for who they were and what they wanted and what their potential was. I'll talk a little bit later about the concept of relational agency and the concepts of social and relationship capital. Then we have outcomes in terms of enhanced well-being, and we're looking both at the well-being of the central person, but also the well-being of those offering care, and Phil will also be giving you some more hard data on that later on in the presentation. We found that FGCs could work really well in setting support in place for change and transitions. It could provide the basis for a much more effective safety net and for the sharing of responsibility between people in a caring network. It could result in people taking up community resources and opportunities, and also better tailored use of social care and health resources. And in some instances, it resulted in a much more collaborative relationship with services. So here's somebody talking about the plan. And this is a plan that didn't just deal with practical aspects of care. It dealt with how people were going to be in relation to each other on a day-to-day, everyday sort of way. And I'll read out what the network member says. I remember so much of the plan, and it's been part of our daily lives, which to me says it's been invaluable. And it really has become a part of everyday life. It's structurally changed the way we relate to the central person for the better. So yes, I think it's been really, really helpful. Recognition. I'm looking particularly here from the network members, so we obviously had similar comments from central persons. Carers, as will be well known to people within the carers the networks online now, people in caring roles often feel that they are ignored, overlooked, and not taken seriously. And here we have a couple of contributions from network members who just so valued the fact that somebody had actually seen them as important and seen them as someone who could contribute, but also crucially, in the last quote here, recognizing that somebody was at their wit's end and I needed to be heard. I needed to be heard. I can't cope with this. And that part of recognition, I'm sure, has a lot of resonances with many people in caring roles. Then this idea of relational agency, it's something that we wrestled with earlier on, but it just seems to be something that makes a lot of sense for people who, for various reasons of vulnerability or impairment or otherwise, have difficulty in exercising agency, exercising influence, control over their everyday lives. And if you have a group of people around you who understand you and where you're coming from, it can make having that influence so much easier. And so by moving away from the idea of agency as being individuals exerting their control on their own, which may work for some people, but not necessarily work in the sector that for people in the sector that we're talking about, the concept of relational agency really takes off as something that actually, through better connection with others, people can have a much stronger influence over their own agenda, their own life, their own preferences, and so on. So I'll read this one out fully because I think it's an excellent statement of this. I feel understood, which helps even though I'm still struggling. There's the understanding there, which takes a bit of pressure off me to be justifying and explaining how I feel all the time. And some of the things that we've put in place, I got to use my creativity a bit as I start to feel better in myself. I still feel like it's quite early days. There's more things that I can be trying to put into place in the future as well from my FGC. So this is somebody who's starting to have the space and find the space to grow and be creative. But that's only possible because they're not having to spend a lot of their emotional and other time trying to explain where they're at, why they can't do this, why they're feeling what they're, and so on. They've actually got that space of being understood, taken seriously, and having agency, which is then supported by their network. Well-being, again, I'm focusing here because of our audience today, specifically on uh, what we learnt from people who are in caring roles as part of networks. And I think that there is a real concern about family and group conferencing in the adult sector, concerns that were expressed at the outset of the research, that really FGCs are a sort of ruse whereby the state steps back and leaves all responsibility and care on informal networks, and it's a big con, and people had better keep away from it because that's the real agenda. So it's quite interesting that our research has found findings that are absolutely the opposite of that. And here we have some quotes from different network members where they are just feeling so much happier, less stressed, and that sense that because everything's now joined up and they're not on their own, they can relax and life is just so much better. And again, Phil will pick that up with more quantitative data later on. But I think this is one of our major findings from the research is the well-being impact on network members and how pretty much exclusively that was positive. Another big thing is around support in place for change and transitions. Interesting one to start with. This is a central person as a young adult, but still sort of, in a sense, needing to fly the nest a bit and finding that the FGC gave that space for them to have those conversations and know that they've got a supportive base, but they can now step outside of that and start to live their own life outside. Another one where an employment specialist was one of the people that came in as part of the early part of the discussion, and then a real focus towards achieving goals in terms of employment. And it's not just central persons that have opportunities for change and transitions. A lovely quote from a network member. I've gone to uni now. I'm doing a degree in fashion and textiles, something that just wouldn't have been possible for them before the FGC. Often the conversations and the decisions that have to be made can be quite difficult, and it may involve people in caring roles saying, I can't carry on doing this, feeling terribly guilty about that, and all that goes along with that. And when decisions about changing care arrangements are made collectively, that sense of guilt and responsibility can evaporate. And that seems very important to some of the people that we interviewed. It felt like everyone was collectively involved in the decision making from one network member. Another one said, everyone's aware. I mean, all of us were present in that meeting. And because everyone's aware, it's not just me that calls up and checks up on the central person, but my older brother comes and visits now more regularly. My sisters are there as well. So we're all there taking responsibility, a shared responsibility for our younger brother. So yeah, really crystallize that sense of being somebody who started off as an isolated carer, feeling like they're carrying all the responsibility, to sharing responsibility, and it feels so much better. Taking up resources in the community and also having having that more of a life. So here's one person who's now going able to be more active, going to the gym more, doing other activities such as bowling, just trying to enjoy life a bit more. So that's good for the central person. It's also good for the network. It's that sense of, we're supporting that person to have much more of the life that they would like to have. Another network member describes, I think this is where central person had a learning disability. She really likes to be part of a community. Two of her friends have organised, maybe every month or every 6 weeks, a creative session in the afternoon where they make food and they do craft. And one of those had happened already, and I think the central person really valued that. So it's practical stuff, but it's making a big difference to people's lives. This is the one that worked well for some, but didn't work well for everybody. So the ideal is that by having the professionals in at the beginning and having that really open, equal, relaxed conversation, it changes the relationship between the person and the people that are supporting them and the professional network so that people can communicate better, things can be tailored much more effectively to people's needs and so on. And we found in some instances that worked. I think that's being part of the FGC thing. It's the intention of it is actually to focus people's minds and get the right sort of help. It has heightened the helpfulness, if you like, of the generally speaking, of the workers involved in my care. In working together in the FGC, that built trust between everybody, the professionals and the family. But I think that's probably the only place where the FGC didn't really work for me. On the whole, it was amazing, but unfortunately, my local mental health team, they weren't as communicative and on board with the FGC as my family, especially my care worker that I had at the time. So FGCs can't solve everything, and if you've got more of a wider surface environment that doesn't really get the idea of an FGC and still thinks that they should determine for people what they really need and what services they should have and what they shouldn't have and so on. If you've got that disjunction between something that's working well for the central person, the network, but that isn't connecting into the wider professional system, it's not achieving what it might be able to achieve for the central person. And here's a last summary, one of uh, a really successful journey through an FGC process. I found the second review really good from where they started to where they were now. He was happy, he was pleased to be back home. It was a huge change for him. He'd been in the care home a significant amount of time, and then to come back to where you lived, where you wanted to be, with the support of your family and services working together, he was happy. I'll think I'll just take this slide, Phil, if that's all right, and then hand over to you for the rest. So, uh, what we now know is what the typical cost of an FGC is. This is based on earlier estimates, and actually, we've now got figures from uh, the study, the actual empirical part of the study, which is slightly lower than this. So broadly speaking, it's a bit cheaper in social care than in a health setting because professional time is cheaper in social care settings than in health settings. So uh, a ballpark figure for what an FGC costs is a bit below or a bit above 1,500. Then what are the other resource implications in terms of budget savings if you're going to invest in this? What are the likely results? And in the current climate, that's something that is of great importance to local authorities. So here I'm just going to summarize some of the other evidence before we actually look at what we found in our study. So in 2020, Camden did a very rigorous service evaluation and looked at a quite a large number of FGCs that they had conducted over the previous years. What they found was that nearly a third resulted in a plan that required no care service input, that 45% had prevented an anticipated escalation of care costs, and only 8% had resulted in an increase in service budgets, which, broadly speaking, suggests that the investment in FGCs had resulted in preventing or reducing costs that might otherwise have come to the local authority. Going back in time, the daybreak service that was offered in Hampshire was evaluated back in 2013, and there they estimated a budget saving of around 1,500 per FGC, which broadly suggests this is budget neutral territory. Going back further, in Kent, a more ambitious estimation of service budget saving of 7,000 per FGC. So I think on the basis of the evidence we have so far, we are not selling FGCs as a way of saving local authorities lots of money. They're something that is broadly revenue neutral, but we hope actually delivers better lives for people and for the people that care about those people. I'll now go over to Phil.
Yeah, thanks, Jerry. So, I mean, when we sort of look at this from a health economics perspective, what we're looking at is the kind of impact on costs, but also the impact in terms of people's lives and their well-being. As Jerry said, the studies that have been done so far seem to sort of estimate sort of relatively modest cost savings, but accounting for the intervention costs, that's sort of likely to be cost neutral. So we had a go at collecting our own data on costs and outcomes as part of the study. And what we did was we asked people to complete a capability measure called ICECAP-O. So there are 5 questions as part of that measure that assess people's kind of ability to live a life that they value. So we asked them at a kind of baseline point and again at 9-month follow-up. And we did that for people at the centre of an FGC, or people sort of liaising directly with services in the case of our comparator group. And we also asked any network members to complete that measure as well. And then what we did was we obtained information from our local authority sites on resource use. So we obtained information on resource use or the services that people were engaging with in the 3-month period before baseline and in the 3-month period before that 9-month follow-up. So a lot of work went into sort of looking essentially sort of line by line through what we'd got through the case notes and interpreting sort of who they'd had interaction with, the seniority of those people and the costs and so on. And as I say, we had a comparator group as well. So this is really important for economic evaluation, but relatively novel in social care. And we attempted to match that comparator group in terms of the kind of broad services that they were getting, but also in terms of sort of demographic factors as well. So if we move on to the next slide. So what we've reported here is the changing costs. That's this top sort of blue coloured table. So essentially what we've done is we've taken the costs that people have at that kind of 9-month follow-up, and we've subtracted the costs of associated with service use from the baseline. So costs increase over time for both the people in the family group conferencing sample and our comparator sample, but costs in the comparator sample increase by a larger amount. So it kind of fits with the findings that Jerry summarised earlier, that it looks as if there's some sort of modest benefit in terms of reduced provision of services potentially, or certainly the cost associated with them. But then obviously we've got intervention costs of around £1,500. So cost saving is sort of likely to be modest. Interestingly, the outcomes, the well-being outcomes, improved in both samples. I mean, I really thought this is something that adult social care can celebrate in the current climate that they're facing in terms of financial constraints. That actually people's well-being improved over time in both samples. So that's for sort of people that have sort of direct contact with services. If we move on and have a look at network members, there's no costs to report here, obviously, but we did still ask them to complete IceCap O. So this is their own well-being, the personal well-being of the people in the networks. And what we see is that well-being improved over time for people that were the network of somebody having an FGC, but actually well-being deteriorated slightly over time for our comparator group. So there's a bit of a kind of health warning here in terms of low sample sizes. We've sort of picked out our adult social care cohort to present today. We can combine findings across health and social care, and we find a sort of similar type of picture, that really the kind of main benefit that we see coming from FGC seems to be experienced by the network members. So a bit of an interpretation. So as I say, similar things happen for people in both the intervention group, so those having FGC, and in the comparator group. So costs increase over time and outcomes improve. But the results look sort of marginally more favourable to FGC, even when we've accounted for those intervention costs. And with the network members, the sort of real benefit seems to be for the network members associated with FGC, and that comes across as the same finding when we sort of combine our results across our health and mental health settings.
Right. So taking things forward, and what legacy are we able to leave from this research project for the sector that hopefully may be useful to people? So we have just launched a set of web-based resources and learning materials, which we commissioned from Research in Practice. And this contains 3 resources. One is a resource targeted at members of the public who may be offered the possibility of having an FGC. This is a real gap at the moment. FGCs are a bit strange. People don't know what it's all about. Some social workers and social care practitioners are better than others at explaining what an FGC is, but we hope that Resource One will provide them with things that they can, little videos that they can show on their phones to people, accessible resources that actually give people, ooh, that might be something that we could do. Ooh, does it achieve that? Did people think that about it? And so on. So we hope that Resource One will be useful in a very practical sort of way. We're aware that there's quite a lot of interest in the sector now about developing FGC services, but people don't quite know where to start. So Resource 2 is about developing a set of materials for senior leaders, managers and commissioners. If you're thinking of developing an FGC service, these are things to think about, these are things to bear in mind, these are the sort of outcomes you can expect, etc. And then Resource 3 is targeted at FGC coordinators, referring social workers, FGC managers, and providing them with online resources that they can use within their initial and CPD training. What are the ingredients of effective FGC practice? As I've suggested, the world out there seems quite receptive to this idea. We're getting huge support from the new Chief Social Worker, Sarah McClinton, who's appears on our learning resources and will appear at our next event selling the message of FGC. But this seems to have gone even higher, that Stephen Kinnock, the Minister of State, at the NCASC conference in November, specifically mentioned FGCs as a promising innovation in connection with the 10-year health plan and the focus on moving provision from hospital to neighbourhood health support. Last year, Camden became the first local authority in England to be rated as outstanding by the CQC. And it was commended for its commitment to person-centred, self-directed support and power sharing with people who draw on care and support. And FGCs were one of the components of that offer, which is singled out as a key mechanism for delivering this. So other local authorities that want to get that outstanding badge, look at Camden and see whether you want to follow them in using FGCs as part of your way of just changing the whole feel of how you provide support, both to central persons and, crucially, to the people that are supporting the informal carers that are supporting those central persons. And if any of you have got a space in your diary next Tuesday, we're hosting a big event in Camden, and it's free. There are still places. If you're interested, contact Zoe Miller on that email.
Thanks, Philip. Thanks, Jerry. That's really, really interesting. I'm sure it's going to